Hello again, and welcome back to King's Podcast, The Wellness Dive with Lucky. I'm your host, Esther Lackie. November, or what do they call it? Movember, where we place a special focus on men's health. Today, we are joined by Dr. Rizwan Hamid, consultant, urological surgeon, and associate chief medical officer at King's, where he'll be taking us on a deep dive on prostate cancer. If you like it, follow us for more on prostate screening and how you can avail it here at King's. Dr. Rizwan, thank you so much for joining us today.
Esther, thank you for inviting me.
We are in November. We focus on men's health, mental health, testicular cancer, prostate cancer. How prevalent are these conditions, especially here in the UAE?
All three are quite prevalent, probably more so than we think they are. I'll start off with mental health. Mental health is kind of a very broad and general term. And most of the studies show that close to 1 in 2 men during their lifetime will have some sort of a mental illness.
Mhm.
Uh, and that sometimes translates or comes from cancers. So, talking about testicular cancer, it is not a very common form of cancer in men. Only 1% of men suffer from testicular cancer.
Mhm.
Figures wise, probably 1 in 250, 270 men will suffer from testicular cancer. But the differentiation between testicular, and we'll come on in a bit to prostate cancer, is
Mhm.
that the testicular cancer generally affects younger men in their
Uh-huh.
20 to 40s. Testicular cancer is one of the success stories of cancer is that once it is diagnosed,
Mhm.
obviously diagnosed early, then there's good 98% chance that the man or young adult, shall we say, will be cured of testicular cancer. The
Mhm.
important thing in testicular cancer is to present early, and the way to do it is that it is recommended all men should self-examine the testes once a month.
Once a month.
Once a month, yeah.
Just like we were pushing women to do self checks on their breasts
Exactly
routinely.
right. Exactly
All
like
right.
that. Yeah.
Okay, so now let's move from mental health and testicular cancer and focus on prostate cancer. How common is it? And do you know any statistics about it?
Prostate cancer is now the most prevalent cancer in men, barring some skin cancers.
Mhm.
So the incidence of prostate cancer is going up. It is still open to debate whether it's because of increased screening or just the incidence is going up. But 1 in 8 to 10 men during their lifetime will be diagnosed with prostate cancer.
Mhm.
But unlike testicular cancer, this is more prevalent in older age, shall we say, above 55 to 60 years of
Mhm.
age.
Mhm.
The incidence starts to go up. And it's said that 80% of the men above 80 will have
Mhm.
prostate cancer.
Okay, you said it's prevalent in men 55 years and above. What about ethnicities? I think I read somewhere where it's more common in Black people.
That is correct. So, ethnicity wise, prostate cancer, for reasons unknown, is more common in black men. Unlike testicular cancer, just going back, it is more common in Caucasians.
Mm-hmm.
We do not know the reason why. And the other two risk factor for prostate cancer, one we have already discussed is age,
Mm-hmm.
but the most relevant which people need to know is a family history of prostate cancer.
Mm-hmm.
So it is said that if father or brother is suffering from prostate cancer, the chances of that individual getting prostate cancer goes up by times 2.
Mm-hmm.
And there's some now research coming out that genetically, if the BRCA genes for the breast cancer runs in the family,
Mm-hmm.
then probably those men are also at an increased risk of getting prostate
Prostate
cancer.
cancer.
Correct.
Wow. Back to the age again. So, are there instances where you've seen men who are below the said age of 55, let's say 40 years, 38, who've developed prostate cancer?
That's very true. So in medicine, we don't use two words, never or always. So you can't say that if it doesn't happen below 55 years of age. It is quite uncommon, but I've seen men as young as in early 40s diagnosed with prostate cancer. Generally, they will be the one who have got a family history of prostate cancer.
But then we're always beating the drums about telling men when they are 55 they should start getting screened for prostate cancer.
Correct.
What would make a younger man, let's say 40 years, that's young, pretty young, to go get a screening? Because from what he's been hearing is, you have to get screening when you're 55 plus.
Like any disease or illness, there are some red flag signs.
Mm-hmm.
And here it would be blood in the semen. You can also say if there's blood in the urine, the urologist will start investigating. But pain while ejaculating, change in the bowel urinary habits,
Mm-hmm.
and also a sudden onset of erectile dysfunction. These are the things which should make men aware that something has changed and seek advice.
And the moment they start experiencing these symptoms, they should go to the urologist.
Yeah, it depends. They can always go to the family physician, which can be the first point of contact. But a urologist should see, especially blood in the urine,
Mm-hmm.
blood in the semen, pain in ejaculation, or sudden loss of erections or erectile dysfunction.
Mm-hmm. Mm-hmm. Okay, now let's jump on to prostate cancer screening. How important is it?
I think it is very important. And the reason for that is, as we have discussed, prostate cancer is probably one of those very few cancers which have got no symptoms or signs, especially early on.
Mm-hmm.
So there is no direct relationship between what we call as lower urinary tract symptoms or symptoms of prostate enlargement with that of prostate cancer. So it is very important that men are aware, especially when they go beyond 50, 55,
Mm-hmm.
that this is one of the cancers which can just hit without any symptoms. Quite often, the men will come for general checkup and they will have the blood test, which is the PSA,
Mm-hmm.
and find out that they have got prostate cancer. So it's very, I think, advisable for men when they go beyond 55 years of age to talk to their healthcare physician, whether the urologist or the family medicine, and start thinking of getting a blood test, which is the PSA,
Mm-hmm.
which I'm
Mm-hmm.
sure you're going to ask me about. That how do we screen men for prostate cancer?
Exactly, that was my next one. So,
Yeah.
how do you do it?
There are two basic things. One is known as a digital rectal examination,
Mm-hmm.
analogous to a breast examination, which generally is done by self, or the testicle examination. This generally men themselves cannot do it. So you rely on a urologist to look at,
Mm-hmm.
to feel the prostate. But you can imagine prostate is like a walnut, or a golf ball. So when you
Mm-hmm.
examine it through the back passage, all you can do is to just examine the surface. What's happening inside cannot be felt unless there's a very big nodule there.
Mm-hmm.
So majority of the times it is picked up by the blood test, which is known as the PSA.
Mm-hmm.
But here something is very important. So if the PSA comes back as high, that does not mean, again, it's not always or never
Mm-hmm.
that one has got prostate cancer, because it is prostate specific antigen. It is not cancer specific. And there are a host of things in which it can be raised. So agreed that it is raised, one needs to be investigated further,
Mm-hmm.
but it's not be all and end all that anybody who's got a high PSA will have prostate cancer.
Let's say you screened your guy
Mm.
and the tests have come back positive, conclusively positive. What is the next step?
The, generally, either it will be done by the family medicine or the urologist.
Mm-hmm.
If it's done by the family medicine, then it will be referred on to the urologist.
Mm-hmm.
Now, here, generally a cutoff point of 4 is taken as high, but now most of us will go with the age related values. So if somebody is less than 50 years of age, even some, I figure about 2 or 2.5 is also significant.
Mm-hmm.
On the other hand, somebody is above 75, 80, then 4 might be normal. So generally, we have now got this age-related cutoff values. That's why it's very important. Once you get the value, it's above 4, see a urologist, and then appropriate investigations would be done.
Mm-hmm.
Here, that would be nowadays an MRI to look at more the prostate morphology in more detail,
Mm-hmm.
to see if we can pick up those areas. So the next step after a high PSA would be a MRI. If that is abnormal, then the next step will be to get a prostate biopsy to confirm the diagnosis or otherwise.
Okay, after the diagnosis is confirmed, what's the treatment approach?
Again, prostate cancer is one of those cancers where one does not need to start treating immediately,
Mm-hmm.
or one might not treatment at all, because there's something known as Gleason score, or type or grade or severity of the cancer. If it is a very low volume,
Mm-hmm.
and the Gleason score is 6, the doctor might elect, the urologist might put somebody on active surveillance, that we will not ignore it, but we not rush to treating it. But then there is an intermediate and a severe variety.
Mm-hmm.
If it is in one of those categories, then it needs treatment. And again, prostate cancer is one of those cancers where the whole array of treatment is available, starting from very localized treatment known as HIFU, which is a high intensity ultrasound scan or cryotherapy, going to the whole gland radiotherapy, going on to surgery, which generally is done with robotics, or a combination of these three things. And they can be with some hormonal therapy. So as you can see, a lot of treatments are available. In fact, I always tell patient is that in a way, the bad news is that you have got prostate cancer, but the good news is that not only a number of treatment options are available, but you need to think these through, because every treatment will have its own pros and cons, and one side does not fit all. But importantly, one has got time to think these through, unlike some other cancers like bowel cancer or bladder cancer, we just have to rush through the treatment.
Yes, so there's this approach known as watch and wait. Does it apply on prostate cancer as well?
It doesn't. We don't use now, or we can use, but we like to use the term active surveillance, because when you say what and watch and wait, sometimes it means that you can just wait, and what is that wait about, and how do you wait it?
Active
So the
surveillance.
active surveillance gives you not only a assurance that something will happen, but also a time frame that will have PSA done on a 6-monthly or 3-monthly basis, MRI maybe on a yearly basis, and maybe a repeat biopsy in 1 or 2 years. So there is a plan. Prostate cancer is one of the most widely studied programs. So generally, most of the patient will fit in on the guidelines in one of the boxes, shall we say. So if I'm on active surveillance, this is what's going to happen. So that is very reassuring to the patient also, that I've got a kind of a roadmap which is being followed. And if these are the red signs along, if this happens, it is going to trigger this investigation and then go on to have treatment.
Okay, now, when somebody develops prostate cancer, does it put a complete stop to their quality of life?
The diagnosis of prostate cancer obviously is mostly it comes as a shock, because most men will come for screening, or one of their friends or family has got prostate cancer, they want to have it checked, and suddenly the blood test is, so the initial shock would be there, which obviously can push patients into depression. But once that happens, there's no effect in quality of life per se during the initial stages. We'll come to discuss if somebody is diagnosed with advanced prostate cancer, then those patients can either present with bone pain, which is the most common site the prostate cancer goes. So one of the things is if somebody develops severe backache or severe bone pain of sudden or origin, then that should be investigated, because that is, especially in the elderly, prostate cancer can present that way. But once one undergoes treatment, be it radiotherapy and especially surgery, that can have an immense effect on the quality of life. And there are two main things. One is urinary incontinence and one is erectile dysfunction. And that's why when I consult patient, I tell them you need to think very carefully. There's a trade-off. And some men will say, I want to preserve my erectile function and incontinence at all costs, and I accept if the treatment is slightly suboptimal. Some other will say, I want to get rid of cancer at all costs, and I do accept that there will be some side effects. And that trade-off is very important. And again, it will be different for different men.
Wow, thank you. I heard Dr. Hassan from oncology the other day. I've had a few talks with him, and at some point he mentioned some killer cancers and not so much of killer cancers. How would you categorize prostate cancer?
Prostate cancer is said that most of us who live long enough will die of prostate cancer rather than because of prostate cancer. So I think that's what he meant. So prostate cancer, one of the cancers you get is left untreated or advanced, can lead to mortality. But majority of the times, men will have some control to an extent, even the advanced one, where one can give them treatment, hormonal therapy, then there is some immunotherapy, then some new type of therapies which can keep the cancer under control. Not cure, but keep it under control. So that one doesn't die of prostate cancer.
Wow, that's a whole lot of information we didn't know, doctor. And so before I let you go, I understand you have a very busy clinic. What is the most important thing that you'd like men to know about prostate cancer and prostate cancer screening?
Above 55 year, give it a really good thought and should get your checked by the urologist by PSA and examination. If you've got a family history of prostate cancer, then I will more strongly advise to have the prostate PSA checked. Otherwise, like anything else, be open to yourself, to your family, get yourself checked, do regular exercise, stop smoking. Obesity has got linked to almost all cancers, but prostate cancer is one of those cancers which is, uh, if it's caught early, we've got loads of treatment to cure prostate cancers. Don't shy away from it. If I've a don't want to be diagnosed because there's no treatment. If there's diagnosement, lots of treatment options are available. And if we cannot cure it, we can control it. So please don't uh, uh, throw it under the carpet. Be open, come out with it, and we have got treatment options available.
All right, doctor. It was lovely having you here. And thank you for everything.
Thank you for having me.
Yeah.
Thank you.
There you have it, Dr. Rizwan Hamid. You heard him, you heard the man. Get screened, get screened, get screened. Until next time, goodbye.